Good evening, everyone. It's 4 p.m. by my time. With us today is Dr. Osahon Otaigbe. Dr. Osahon Otaigbe is a consultant public health physician and biostatistician at ERA Specialist Teaching Hospital. He holds a master's degree in medical statistics from the London School of Hygiene and Tropical Medicine and is a fellow of the West African College of Physicians. At ERA Specialist Teaching Hospital, Dr. Otaigbe supports both hospital-based and community-based studies, particularly in the area of infectious diseases. He works with research teams and consortia to strengthen research planning, data quality, and study implementation. He also serves as an honorary lecturer at the College of Medicine, Ambrose Ali University, where he teaches epidemiology and biostatistics. He is a co-editor of the Archives of Clinical Research, the official journal of the Faculty of Clinical Sciences, Ambrose Ali University. Actively involved in mentoring students and young researchers, he has facilitated numerous training sessions on data collection and analysis, both within and outside the hospital community. With a practical, enhanced approach, Dr. Otaigbe helps healthcare teams build confidence in managing data, ensuring quality, and enjoying meaningful insight to support evidence-based decisions. His training sessions focus on equipping participants with foundational skills in data handling, from field collection to data analysis and interpretation. Ladies and gentlemen, please join me to welcome Dr. Osahon Otaigbe as he takes us on the second session of our series, Formulating Research Ideas and Questions. Please, with clapping emojis, please let's welcome Dr. Osahon Otaigbe. Sir, you have the floor. Thank you, sir.
All right, thank you very much. It's a pleasure to be here. I see all the clapping emojis. Thank you. I can, I see all of them. Thanks a lot. So I'll be taking us on this topic, the second in this series, Formulating Research Ideas and Questions. And of course, as you can see, I'm one of you. I'm an alumnus of UNIBEN. I also had my medical degree from University of Benin. And I'm really excited that in the college, we have this initiative, an undergraduate research network. I really don't think, I don't remember having something like this when I was in school. And so this is something I'm really very excited about, to see that even as undergraduates, we are really interested in research. Back then, our research exposure was limited to 500 level, 600 level, 500 level then, because that's when we're doing ComHealth projects. So that's the bulk of all of our research experience started and ended with that research project. But I'm happy that now things are people are getting enlightened, getting more interested in research, having this network. So I want to encourage us to maximize it, learn all you can learn, and ensure that because research is actually what drives the world these days. Ideas, research questions, research discoveries, innovations, those are the things that help medical practice. These days, you keep hearing evidence-based practice, evidence-based practice. When you say things like that, what that means is research. We are looking at research, how research can drive our practice. So having said that, I'll just take one of the aspects. Later on in subsequent series, I will also take some other aspects. I'm more of a data person, more in biostatistics and analysis, but I also have some expertise in research methodology. So today, we'll be looking at formulating research ideas and questions. Before I start, there's something I like to do. I always like to, in my sessions, I always like to ask some questions, kinds of teaser questions on unrelated topics or a topic unrelated to what we are discussing. So just to get our views and our ideas. So for today, the question I'll be asking is a very simple one. You could put down your answers in the chat box while we start. So this is the question. If you had to delete all the apps in your phone and leave only 3, which 3 will you keep? If you had to delete all the apps in your phone and leave only 3, what are the 3 apps you are going to keep? So you can just put, I don't know if they are able to chat, or if you are able to, then you can just send in your answer. Let me just see maybe 2 or 3 responses, and then we'll proceed. Okay, Google Docs, Adobe, Acrobat, WhatsApp. Okay, I see Akko Jeremiah. Spotify, Bible, YouTube. Okay, I see that. LinkedIn. Okay, I see that. WhatsApp, LinkedIn, WhatsApp, LinkedIn. Okay, so WhatsApp. Almost everybody saying WhatsApp. That's nice. Interesting. MetaTrader. Oh, interesting. Okay. WhatsApp, YouTube, LinkedIn. Okay, nice. WhatsApp, Notebook, TikTok, ChatGPT, YouTube. Okay, so great. Telegram, oh, it's great. Okay. All right, that's fine. So I've seen all of the responses. So what this just tells us is that people are different. Essentially, people are different. So you may want to look at all of these responses and generate something out of it. Okay, but that's not why we're here. So this is just a teaser question, just to know what gets people ticking and what people are really interested in. So it's nice. There's no right answer. There's no wrong answer. But I think WhatsApp seems to be the most prevalent here. So let's look at our topic for today, which is on research. So the way I'm going to do it, I will focus on 2 major aspects: research questions and research objectives. Right. So I expect that having listened to this session, at the end of it, you should be able to describe the need for a research question and know how to formulate a research question. Also, you should be able to explain the difference between a research question and a research objective. Well, there's a subtle difference which you just get to learn. And then you should also be able to formulate research objectives. So just a reminder of what I believe you must have learned before now. There are different definitions of research, but the one that really appeals most to me is this definition that says research is the systematic collection, analysis, and interpretation of data to generate new knowledge and answer a certain question or solve a certain problem. So essentially what we're trying to do in research is to answer a question or to solve a problem. And we do that through collecting data, analyzing the data, and interpreting the data. That's what research is all about, essentially. And so if we know that we need to answer a certain question, it now goes without saying that you need to be able to formulate a question that is researchable. Okay, so we're going to look at some of the reasons or some of the characteristics of a good research question. But before we do that, let's ask ourselves, what exactly do we mean by a research question? What is a research question? So a research question is often generated from a problem statement. So there is a problem, and then you have stated what that problem is. Having stated that, your question now comes out. Now, research problems are all around us, okay? You don't need to look too far before you can identify a research problem. And so if you have a researcher's mind and maybe you are going for your postings, you are going for field work, or even as you are doing lectures, if you have a researcher's mind, you will just start identifying problems in different areas, especially in our setting where we are a resource-limited setting. There are lots of problems all around us begging for research into them. So how do these problems arise? So largely, it's a problem of evidence. So whether there's scarce evidence, in which case we don't have enough information about a particular problem. So we may say Lassa fever, for instance. Do we have enough information to tell us what exactly is its prevalence in Edo State? Is there evidence? Do we have evidence about that? So if the evidence is not there, then that's scarce evidence. Either it's not there or there's paucity of evidence. And this is one thing I've seen that students always like to say when they're writing their research, their problem statements, and also when they are trying to justify their study. Most times they will tell you there's paucity of information, there's paucity of evidence, and the likes. So even though many times that may not be exactly very correct, but that's one of the reasons, or that's one of the ways in which we may see problems. So when the evidence is not sufficient, then that will tickle our fancy, our research fancy, and let us know, okay, is this a research gap I'll be interested in filling? Then secondly, you may have, evidence may not be scarce, it may be there, but the evidence may be conflicting. So, for instance, you may have, like I remember during the COVID-19 period, some persons were saying you could use, was it chloroquine they were talking about? If I remember well now, is it, yeah, I think chloroquine or azithromycin. There were some drugs that some people were touting. So some people will tell you this works, some other people will tell you this doesn't work. And you will see, if you go online or you search the literature, you will see some studies in favor of this, some studies against that. And I'll give you another very good example. I'm from a center where we dwell so much on Lassa fever. We've made record-breaking strides as it relates to Lassa fever. So before now, for one of the drugs that we really use that has really helped in our Lassa fever management is ribavirin. But there are some studies that will tell you that ribavirin should not be used for Lassa fever because of its potential toxicity. And some other studies will tell you that ribavirin is very effective for Lassa fever. So in that case, you are having conflicting evidence. So once there's conflicting evidence, that is already a problem. Once you see that somebody is telling you one thing, another study is telling you another thing, that's already a research gap. So you want to find out what is the true situation. Okay. In fact, in that case, you may now want to do what we call a systematic review. You want to gather all of the different evidences, plus the ones that are conflicting, the ones that are in support of what you think. You bring them all together and find out, okay, what is the aggregate? What is the overall consensus? All right. And if it's a study where you have data, you may want to also do a meta-analysis to find out, okay, what is the real effect at the end of the day. Then sometimes you may have, the evidence may be there, it may not even be conflicting, but sometimes if you read through the literature and you see the evidence, you may have reasons to doubt the validity of such evidence, perhaps maybe because of the methodologies that were used in that study. So maybe they did a study, and in the study, it wasn't as rigorous as you would have expected it to be, or the methods, the research tools they use to collect their data, you think those tools are not robust enough to really assess what they are meant to assess. So, of course, for you to have that thought, you yourself should be a relatively knowledgeable expert in that field. So you may think there's some poor evidence. So either there's scarce evidence, there's conflicting evidence, there's poor evidence. All of these are areas of interest. So you want to find out what exactly is the situation of things. Do I want to generate new knowledge? Do I want to corroborate knowledge that's already there? Do I want to find out what's the full truth? So that's what research problems, that's where they arise from. And like I said, when you go through your different postings, one of the things I always like to encourage medical students to do is to read journals, read journal articles. It's an advice I give people, and I think I learned that from when I had to do my master's degree. I noticed that many of us in this part of the world don't really read articles. Well, in my time, the bulk of what we were reading were textbooks, and we had a lecturer then she used to tell us that anything that is already in print, it becomes stale almost immediately. But journal articles keep coming out, and it gets refreshed. Okay, so when you're reading journal articles, it creates that researchers, you're able to read and appreciate how researchers think, how they write, how they say things. Okay, it also helps you know what to expect in the research world. So it's a good thing to do. Not just sticking with textbooks, and these days I hear that it's not even textbook students read. Most times now it's AI and ChatGPT that people read more often. So, but I would like to also recommend, if you read journal articles, you get to understand how research is done. You get to understand how it is reported. And in doing that, you're also building up your own skills. All right. So let's quickly tell ourselves what a research question. We've said what a research question. We've tried to give ourselves some idea of how problems arise. Now, this slide here is just telling us, it's like defining it, okay? So a research question is a clear, very, very important, is a clear, focused, and concise question around which a research work is centered. So the whole of your research work is centered around the research question. So that goes without saying that if you have an unclear research question, then your whole research work is going to be unclear. Nobody will really, it won't be well appreciated. But if you have a very clear, specific, focused research question, then your work is well guided to bring out something that is of interest to anyone who reads it. So why exactly do we need a research question? So I've mentioned some of them and I'll mention them again. Number one, and I think most importantly, it provides clear focus and direction for the study. So everything in your research rises and falls on your research question. Your research question is what directs your methodology. It's what directs your results. It's what directs your discussion. It's what directs your literature review. It's what directs your conclusion. Everything, the whole study, okay? The direction and focus for that study is your research question. So it's absolutely very important you get your research question right. It also defines the scope of the study. So with a research question, you're able to know what are your boundaries. And that's because in research, one researcher or a group of researchers cannot answer all of the questions. There are lots of questions, okay? So you must subject yourself to a boundary. You must subject yourself to a limit. This is where we are going. So your scope in time, in budget, in resources, everything about that, okay, is based on what your research question is. So are you doing a study on COVID-19 in Edo State or in the whole Nigeria or in the whole West Africa? It's your research question that will give you that direction and that scope. All right. Then closely related to that is the fact that it helps you in resource allocation. One thing we must know is that research is not easy. It's not cheap. It doesn't come cheap. So it demands lots of resources, okay? And because resources are scarce, you need to allocate those resources wisely. And again, your research question comes in very handy for that. So this is not an exhaustive list, but I think these are those are some of the most important things when it comes to the need for a research question. And the last one I have here is that it aids evaluation of the research. So if you have set your question, at the end of the day, how you know your research has been effective or how you know your research has met its target is if you have answered the research question. And as a matter of fact, any conclusion you are writing in a research work, that conclusion must be an answer to your research question. Otherwise, you have not conducted that research. If you remember what you said research was, you aim to solve a problem or to answer a question. And so once you've asked that question, excuse me, once you've asked that question, all of the things you are doing is geared towards providing an answer. And so Your evaluation of the research will now be how well have I answered this question? Did I answer this question or not? Have I answered it fairly? So it's a research question that helps all of that. So what are the types of research questions we have? So basically, there are different types, but I've grouped them into three. So they are the descriptive type of questions, okay? So in descriptive questions, what happens is that the researcher is just describing the features of an entity without having to make any comparisons or without having to examine relationships. And so there's an example here. The example here says, what are the common presenting symptoms of COVID-19 among adults in Nigeria? So here, we just want to have a description of what these symptoms are. We are not interested in comparing, are these symptoms the same in Nigeria as it is in China, or are these symptoms in children the same as it is in adults? No, we just want to know what those symptoms are in adults. So this is just a purely descriptive question, all right? What is the prevalence of Lassa fever in Edo State? Purely descriptive, okay? We're not trying to compare. The second type is the comparative questions where we want to compare two or more groups. And we have a question here. How does COVID-19 mortality rates differ between adults and children in Nigeria? So if you look at this question, you will immediately see that there's a comparative aspect of it. You want to find out, you want to measure the mortality rates in adults, you want to measure the mortality rates in children, and thereafter, you're going to compare those rates. So please, can we have people, those muted, so we can hear ourselves? Thank you. So we want to compare what are, between those two groups, we want to compare mortality rates. So that's a comparative type of question. And this is a very common type of research question we see. Okay, so we are looking at a particular topic of interest. We want to find out what the description of that thing is and compare that with another. Then the third one is what we call causal questions. So here you are trying to establish some form of cause-effect relationship, all right? So an example will be, what is the effect of COVID-19 on mental health? So that's a question in which you just want to establish, does COVID-19 have any effect on mental health? Okay, so it's a causal type of question, all right? Of note is that causal questions and comparative questions are quite similar because it depends on how you frame it. For example, the question on mortality rates between adults and children, the difference, whether there's any difference, it could have also been framed in a way that you say, okay, is there any effects of age? Does age have any effect on the mortality rate of COVID-19? So in that case, even though it's still a comparative question, you've framed it and worded it in such a way that it's looking more like a causal question now, because you're now looking at the cause and effect. Okay, does age have any effect on COVID-19 mortality rates? All right, so they're quite similar. They're both analytic questions, but the descriptive question, there's no form of analysis. So you could broadly divide them into descriptive and analytic questions. In descriptive questions, you're just describing, you're not trying to find associations or relationships. But in analytic questions, you want to find some form of associations, relationships, correlations, and those ones could be comparative questions or causal questions. So quickly, we'll look at the characteristics of a good research question. So if we're looking at a research question, a good research question should be clear. And I'll give us examples on the next slide. It should be clear, it should be researchable, it should be important, it should be feasible, and it should be ethical. Excuse me, sorry, I have a bit of a cold here. And it should be ethical. So if we look at clarity, I'll just give us examples of a bad example of clarity and a good example of clarity. So for each of these characteristics, I'm going to be giving us those kinds of examples. So when we say clarity, clarity means you should be as specific as possible. So look at this bad example. A researcher wants to find out, is hypertension common around Lagos patients? Now, if you look at that question, the first thing that comes to mind is, this is vague. Firstly, what do you mean by Lagos patients? Do you mean all of the patients in Lagos or in a particular hospital? It's quite vague. It's not specific, all right? But if you look at, if we try to refine this and make it a little bit more specific, okay, we can say something like this. What is the prevalence of hypertension among adults? So we are now trying to hone down on the population of interest. What is the prevalence of hypertension among adults aged 40 to 70 years attending the general outpatient clinic at the Lagos University Teaching Hospital? So this question is clear. It's clear because it's specific. It has told us what the population groups are, and it has honed it down so that you are not just making vague statements. In research, the clearer it is, the better for you. Now, the next characteristic, which is also very important, is that your question should be a researchable question. And this is one very important area we must really appreciate. When I talk to my project students, I always emphasize this area because many times people have ideas in their minds that they have romanticized. They just, they want to do, something is so important to them, okay? But the way they have framed the question, they have framed it in a way that is not researchable. And the example I've given here is this: should nurses care more about infection prevention? Perhaps maybe someone went to visit his family member in the hospital, and was privileged to observe the health workers in action. He saw a nurse attending to a patient, checking the vital signs, maybe with ungloved hands, then goes to the next patient, checks or changes the urine bag, then from there go to the next patient, not washed hands, this time trying to do the linens, or maybe help the patient, prop up the patient and do other things. So touching the beds and the beddings and all of that. And in your mind, you now begin to wonder, is this, I don't know, infection prevention and control practices here? And you now say it's something that now interests you and you now want to research it. Okay, you want to maybe do a study that why are nurses or why are healthcare workers not concerned? Now, if you say something like that, or if you say, should nurses care more about infection prevention, that is not exactly a researchable question, because in research, one of the things that are important, you need to know what your variables are. What are the variables you are trying to measure? So if I say, should nurses care more about infection prevention, what exactly am I trying to measure here? Is there anything I'm trying to measure, or I'm just making a moral judgment? I'm trying to make a statement that I cannot really put down in pen and paper. Now, what you may be really interested in is hand hygiene compliance among nurses. Okay, does that really reduce hospital or healthcare associated infections in surgical wards? So if you put it in that way, it's more researchable. It's a question that you can have variables for. You can have your outcomes, you can have your exposure, you can measure, and you can give us findings. So some of the things you should try to avoid, especially if you are not doing qualitative studies, if you want to do quantitative studies particularly, you should be able to have questions that can produce measurable variables. So don't just ask questions that are moral questions, in quotes, or questions that are questions about feelings. No, you need to ask questions that can have some form of objective measurement, okay? But again, there's the other side of it. If you are doing qualitative studies, in which case you are trying to measure attitudes, perspectives, opinions, in such cases, you could ask your questions in manners that are different from quantitative studies, but even then, they still have to be researchable, things that you can measure. But their own type of measurement now does not have to do with numbers. When you talk of qualitatives or qualitative studies, they have now, you're looking at words, you're looking at thoughts, all right? But they can still be evaluated. So that's just about researchability. There's a whole lot of work on, or a whole lot of things to know about something being researchable. But the general idea is that if you're thinking about it, that's where conceptualization of study comes. If you're thinking about it, think about what you really want to measure and an example of what your result will be like. So try to imagine, if this is my research question, what is an example of the finding I hope to get? If you cannot answer that question, if you cannot get that right, then you know your question is not researchable. But if you have an idea of, okay, this is the expected result I could get from this type of question, then chances are your question is researchable. Now, the third thing is important. So a research question must be an important question, okay? So this goes without saying. Like I mentioned earlier, research is expensive, it costs time, it costs money. And if you look at the ethics of research, there's no research that is without risk. All research have their risk, even if it's very minimal risk, but all research have risk. It could be even risk of wasting of the patient's time or the participant's time. So if you have research participants and you're asking them questions, that time that you're taking from them, they could have used it for something else. So make sure you're not wasting people's time. If you want to do a research, it should be a research on an important issue. Now, the example I've given here, I said, do doctors prefer blue gloves or white gloves in the ward? Well, this is quite debatable, but to me, it may be a bit frivolous, except there are some reasons to believe. Well, I think I once read an article that said that blue gloves have their advantages over white gloves. You can easily see if there's a tear or prick or stuff like that. And in fact, people have actually tried to look into these things. But the point is this: if you are going to be doing a research, it must be an important issue. And in our side, we like to say it must be an important public health issue, because I'm in public health, okay? So you in the clinical field, in public, whatever space you are in, it must be important relative to that space. If it's maternal and child health, it must be an important maternal and child health question, okay? So it must be something absolutely very relevant. We can't joke with that, all right? Then feasible. Your research question should be something feasible. And this is particularly important for students like we are, medical students. You know that you are limited in time. Most times you may not have more than a year. Sometimes it may not even be up to a year. You don't have more than a year to do your research project if it's an undergraduate project you're looking at. You are limited in your budget, okay? So your research work, most times, which is unfortunate, may not be funded. You may not have funding available for your work, okay? Then you're also limited in scope. So because of those limitations, your questions should be things that you as a researcher can answer within the limits of your budget, your scope, and your time, okay? So imagine this question: what is the global impact of malaria control policies over the last 50 years? Again, this is, apart from the fact that it may not be too feasible, it's not even as clear as it should be, all right? So if you want to break it down to something feasible for maybe an undergraduate researcher or a graduate researcher, you may say, okay, what proportion of febrile patients tested at the outpatient laboratories are positive for malaria within a 1 month period? So this has made it more specific, it has made it clearer, and it has made it more feasible, all right? Then the last one is this, ethical. So this is one thing we cannot joke without. And I'm very sure you're going to have interesting sessions with Professor Morenike Pong on ethics in research. Please make sure whatever you do, make sure you don't miss those sessions. They're absolutely very important. In ethics, you can't do sound research bypassing ethics. You can't do that. So all of your research must be ethical. And so your research question itself must be ethical. So you cannot ask a research question, for instance, that says, does withholding ART from HIV positive patients? In fact, if you just continue like that, the way you have framed it already, it gives the impression that you want to withhold ART. You as the researcher want to withhold ART from HIV positive patients. So if you know that ART is important for those patients, you cannot do a study in which you by yourself will deliberately withhold something that is good for those participants. That is highly unethical. So you can't do such study. Okay. So one of the things you should note, if you are interested in research, always look at the ethicality of research, because we are dealing with human beings, human subjects. All right. You must respect lives. There must be respect for their autonomy. Again, I'm sure you know of all of those principles. You must make sure you are doing no harm. You must make sure the benefits outweighs the risks. All right. You must make sure there's justice. So all of those things are absolutely very important. Okay. So there are lots of different ways we can look at characteristics of research questions. So these are just some of the very important ones you must know. There are other criteria. There's one we call the final criteria. It's also very similar to this. What the final criteria just talks about is it uses different words for some of these things. For example, feasible, final, F is feasible. It's also here interesting. Okay, then it must be novel, it must be ethical, and it must be relevant. So that's what we call the final criteria. Still talking about characteristics of a research question. So if you are doing a research question and it's not feasible, it's not interesting, it's not novel, it's not ethical, it's not relevant, then chances are you don't have a good question yet. So on the next slide, I'll just give us a question. What do you think about this research question? Let me read it from here. It says, what are the effects of exposing people to high levels of air pollution? What are the effects of exposing people to high levels of air pollution? So you could just put in the chat box what you think is right or wrong. Or okay, no, let's stick with wrong. What you think is wrong with this research question? Yes, Emmanuel says it's unethical. I agree it's unethical. I agree it's unclear. Yes, I agree with that. I think it's not very specific. I agree with that. There's no clarity. I agree with that. It's unethical. I agree with that. It's not ethical as it could tamper. Yes, I completely agree. It's vague. Yes, I agree with that. Unethical and too general, not measurable. I agree. All right. So, yeah, so this tells me that at least we are following. Um, so for me, all of the things we have said are
I'm no longer hearing you. Is it only me?
It's not only you.
Hello, sir. Is there?
I'm sure he's having network issues. Definitely going to join back. Just let's stay put. Emmanuel, do you have his slide?
No, sir, I don't have his slide.
Okay. I'm trying to reach him.
Good evening, Dr. Lawa. Thank you for joining us today as well. To everyone, please exercise patience. Our speaker will be on briefly. Thank you.
Hello, why is the house so quiet?
Good evening. Our speaker is currently having a slight network setback. We'll be back as soon as possible. Please exercise patience. Meanwhile, there will be an assessment available to the email you used to register by tomorrow, Monday, which will include questions from the two sessions we have had. The questions will pertain to what we have been taught so far. So please do well to engage in these exercises when they are made available. Like I said, please exercise patience. Our speaker will be back on briefly. Thank you.
I don't know if we're having challenges. I can take his slides forward. I have his slide deck with me. So
Oh.
if you could,
Okay.
yes.
I was actually looking for his slide so that I can take. Okay.
Yeah,
Thank you.
I have his slide deck. So
Oh, great.
I usually have problem with this.
Google Meet. Yeah.
Yeah, actually this what is it? Let me see what I can do.
Okay. Alternatively, you can share with me, Marcel.
Maybe I send to you. Yeah.
Okay.
I think that might work. I'll send to you now.
Okay, ma'am.
Good evening, Prof. Morenike. Thank you for joining us. Please let's, with clapping emojis, welcome and appreciate the presence of Prof. Morenike. She will be our host for the next session. Please anticipate. So please, thank you for joining us, ma.
Yeah, thank you. Could you? I've sent it to you. See your WhatsApp.
Yes, I'm opening it.
Okay, good. You want to take it?
Yes, I will.
Excellent. Okay, then. Over and out.
Okay, ma'am. So I need to share screen. I'm also having difficulty sharing screen. So let me log out and relog in with another device. Hello? Hello? Please
Hello,
come.
sir. We
I
can
can
hear
hear you,
you.
sir.
Okay, thank you.
Thank you, sir. We are continuing now. Please, everyone, let's pay attention. Thank you, sir.
All right. So when you are formulating research question, there are critical areas where you need to take a deep look into. You need to follow some process because your question is going to determine how successful you are going to be able to carry out the research. So you have to have a clear question. So usually you develop your question by looking at a broad area. You have a broad topic where you want to look into. So the areas where you pick your question from, so you pick a broad theme, then you gradually narrow it down. So when you pick the broad area, so for example, I want to do a research on Lassa fever vaccine. That's a broad area. I'm not looking into specific. I want to look at Lassa fever vaccines in the blacks. That's quite broad. Then you now carry out literature review, and I mentioned that we're going to be doing literature review in our subsequent classes to look at what has been done in this area. By your literature review, you're able to identify what is known, what is not known, and the areas, the gaps in knowledge. With that gap in knowledge that you've identified, you're now able to narrow down your topic to the specific area. That's what gives you the specificity in terms of the question you're answering. So you start broad, look at the area you want to focus on, then you do a plenary research trying to understand what the gaps are in knowledge around the topic. With what you've identified, you now narrow, you pick a specific area and you ask your question around that area. So you need to frame the question in such a way that it is answerable, as Dr. Otaigbe has mentioned earlier. So in framing your question, there are important questions you ask yourself to frame your question, and there are different framework that is used to ask question, but the most common one is what we call PICO or PICOT, depending on how you're looking at it. So the first P is the population. What group of people are you asking question about, or what situation are you asking question about? So the population for whom you want to answer the question about should be clear in your mind. So for example, in one of the example Dr. Otaigbe gave earlier, he said, I can't remember the exact example, he talked about people around Lagos. So who are the people around Lagos that you are trying to answer a question about? You need to be clear in your question. So If it's people who live in island, that's specific. If it's the whole population of Lagos, or if it's a particular area within Lagos that you're interested in, you need to be clear with about the population you are studying. Then secondly, you need to be clear about the intervention which you are testing or which you want to identify how it works, or you want to answer a question about. The intervention you are looking at should be very clear so that whoever sees your question will know what exactly you're talking about. Then if there are comparator, so for example, you are comparing male and female, you are comparing intervention with vaccine against those who are not vaccinated. We need to be able to know those who are the population you are comparing to. Then the outcome you want to study, the outcome of interest in your study should also be clear. Then you possibly can mention the study design, which you want to use to answer the question. So effectively, when you look at any research question, all of these components should be present. This type of framing of question is particularly appropriate when you are looking at an experimental study. In observational study, your intervention will now turn to what we call exposure. So in that case, it will be population exposure comparator if it's applicable, and outcome. All studies you're going to carry out will definitely have either an exposure or intervention as well as an outcome. There's always an outcome of interest in every study. So you're going to combine each of these to frame your question. So let's look at this example. So in this example, the broad topic is vaccination coverage. So you pick interest, you possibly heard the news about the introduction of HPV vaccine, and you want to look at vaccination coverage of HPV vaccine. That's quite a broad topic. There are a lot of things that can be done under vaccination coverage. So you've gone into literature, you've done your search and all of that, and you've noticed that the coverage of vaccine in rural area have not been well documented, and you decide that you want to know the determinants of vaccination coverage in rural area. So you've narrowed your question from just looking at vaccine coverage to knowing what determinants of vaccine coverage is amongst dwellers of rural areas. You can now formulate this into a research question, and the question here is, what are the barriers to vaccination uptake among children in rural communities? So to be sure that you follow me, can anybody tell me what the population is in this question? I'm going to look at the chat box. Just put in the chat box what the population is. Yeah. Okay. Please, if Dr. Otaigbe comes back on the call, can you let me know? Okay. Children in rural communities, children in rural communities. Okay, children. All right. So, great. It shows that we are following the conversation. So, the population we are studying in this question is children in rural communities, which is rightly said. So, what is the intervention we are studying, or the exposure? I'm coming back to the chat box to see. Okay. Yeah. So the exposure we are looking at is vaccination uptake, and the outcome we are looking at is what are the barriers to the to vaccination uptake. So that is how you look at every research question you see. And there is this thing about research. All the components of research are interrelated. Your research question will determine your objective. Your objective will determine your study design, and your study design will determine what type of results you can get and how you can discuss your results. So everything is interrelated. Indeed, the title of your work should correlate with the main objective of your study. So everything in your research are interrelated. And as it has been mentioned, the first step to a research is to have a research idea, which you turn into a question that we are handling. Then you turn it into an objective, which you now set out to answer by carrying out appropriate design. So every question you have, you should be able to break it down into this component. If you cannot do that, then it means the question is not well constructed. This is another example, acute respiratory infection. This is as broad as it can be. So there are a lot of things to look into in acute respiratory infections. But you can do research, plenary research in terms of literature review, and identify areas that have not been answered, or if there are conflicting results on in acute respiratory infection, which you intend to answer for your population. Then you now come up with the areas where you are interested in. In this case, the interest is on prevalence of self-reported acute respiratory infections among under 5 children in rural areas. So this narrow topic has now been turned into a question, which is, what is the prevalence? So what we are looking at for is the prevalence of self-reported acute respiratory infection in which population under 5 children in rural communities of Imo State, Nigeria. So the outcome you want to know, what you want to know about this population is the prevalence of what? Self-reported acute respiratory infection in which population under 5 children in rural communities of Imo State. So every research question you see, you will definitely find these components in it. It may not be exact framework as we use. There are a lot of different frameworks that are used for different study design, but as I mentioned, it is the PICO that is the most common one, and it is the one that is applicable for most study design. So let's now go into research objective. Like I mentioned, from your question, you can design an objective. Your objective is the steps that you want to carry out in your study, which will help you answer your question. So your objective to achieve, the specific objective you intend to achieve in your study, and the steps to answer a research question is what your objective is all about. So what steps, you have a question. So what steps are you taking to answer that question? That's what your objective is all about. So why do we need to state an objective?
Hello, sir.
Yeah.
Dr. Osahon has joined us. He
Oh,
joined
great.
us now.
Okay. Okay. All right. Thank you. So, Dr. Osahon, welcome back, sir.
Actually, I'm still not back. My sister, I don't know what's happening. My network is up. My router, I had to restart my system, but I'm still not able to join with my system.
Okay,
I really don't know why.
Let me change your slide from here while you take it up.
Okay, that's fine. So I can just continue speaking from where you stopped, and but I'm using my phone now, so you can just be sharing the slides.
Okay.
Okay. So thank you for standing in while the network and all of the technicalities reared its ugly head. I'll just try to round off because I think the bulk of what we need to know has been stated. I heard you were talking about the research objectives. So research objectives are those steps you need to take to meet or to answer your research question. So I'm looking at my own screen, so it may not be, I don't know if it's the same as what is presented, but I'm looking at my screen here. So just follow me. I'll share my slides with you at the end of the session. And if you have your questions, you can jot them down. So I'll just, within the next five minutes, because we are almost at the top of the hour, within the next 5 minutes, I'll just try and round off everything I have to say. So in research objectives, it provides clear direction. It helps us in planning and methodology. And then just like we have characteristics of good research questions, we also have characteristics of good research objectives. And this is where the popular SMART comes in. So a good research objective should be specific, it should be measurable, it should be achievable, it should be relevant, and it should be time bound. So that's SMART. So specific, so use broad terms, vague terms, make it as clear as possible. And in my slides, I gave some examples of bad specificity and good specificity, all right? The measurable, it's also close to what we discussed earlier in being a research question being researchable. So measurable means you want to have variables that you can quantify or you can measure, all right? So in your words, the words you use to frame your objectives, they should have some levels of measurability within them, which means that you should use some action verbs, all right? Then the next thing we'll talk about is relevant. Then in relevant, again, just like we talked about important research question, so a relevant research objective is something that is important, okay? Then also it must be relevant to your question. So you don't just put objectives that have no bearing with your research question. It must be relevant to your question. Then of course, time bound has to do with, there must be a time frame. Then, so just like you have ways of formulating your research questions, you also have, they are quite similar. So you break down your research question, you define the specific tasks you wish to accomplish and the milestones you wish to use. Then one very important thing you must avoid. Remember, we've been talking about clarity, specificity, avoid vague words. So if you're using, if you want to frame a research objective, I don't expect you to be saying to study so. No, your work is already a study. So use a more specific term, maybe to determine the prevalence or to identify the factors. Do you understand? So don't just use vague words to understand. No, your work is already trying to understand something, but your objective should be more action-oriented and specific in the framing. All right, so that's also very important. Then I'll end by saying research, the foundation of successful research lies in well-defined research questions and objectives. So there's no, you can't hide, you can't do without this. Your research question must be on point, and also the steps to achieve it, which are your objectives, they must also be on point. So remember the CRIFE, C-R-I-F-E, or the final criteria for research questions. And for the research objectives, remember the SMART objectives. And as you remember all of these are pointers to how you need to develop your research question to make sure that your work is a work that can be referenced. It's a work that is rich. It's a work that has undergone the rigor expected of research. So at this point, ladies and gentlemen, I'll just pause here. Once again, I apologize for the hitches. I don't know what happened exactly, but thank you for staying by, and I'll take some questions if you have questions. Thank you.
Thank you, Dr. Osahon. Despite the network challenges, we were able to finish strong. Thank you very much. Also, we are very thankful to Dr. Lawal for standing in when the network glitch happened. So we'll be taking questions. Please, your questions should be dropped in the chat box as quickly as possible as we are past the 1 hour mark. Thank you. All right, so we have 2 questions in the chat box. The first question is, when using PICO to choose a topic, must all the components be incorporated in the topic? That is, must the topic have population, intervention, comparison, and outcome at the same time? Or can it have just population, intervention, and outcome? That's question 1. Then the second question goes, is it possible for a research question to have more than one research objectives?
Okay, so I can quickly take that. So for the first question, thank you for that question. Now, I remember I heard Dr. Lawal saying that there are different frameworks. So yes, there are different frameworks. PICO is just a very common one, especially when you're doing clinical research questions, you want to do a systematic review and the likes, but it's not compulsory you have all of them, especially the IC aspect of it. So there's another framework called the PEO framework, where you just have population, exposure, and outcome. And so for most studies, you are likely to have that. So it's not all studies you may have an intervention group and a comparison group. And if you remember the types of research questions we talked about descriptive questions, we talked about comparative questions, we talked about causal questions. So in descriptive questions, you're not likely to have intervention or comparison groups. So you just likely have the population, all right? Then you may have the outcome, all right? Then for comparative, that's where you're now likely to have the intervention and comparison. So it's not compulsory, it follows all of that. There are different frameworks, okay? Then the second question was on whether I can have multiple objectives for a research question. And yes, that's the simple answer. So essentially, your research objectives, now I'm using that word research objectives to mean specific objectives. Okay, so that's the way in which I'm using the term research objective as your specific objectives. So if you are doing your, maybe if it's a project work, you will have your general objective or your aim of the study. So that aim is like your research question, the overall thing you want to answer, the overall point where you're going. Then the specific objectives is what we are discussing here as your research objectives. So those are, you could have multiple, up to 3 or 4 for a particular research question. It's very much in order. Answers your question.
Hello.
Thank you so much, sir. Dr.
Yeah.
Lawal.
Okay, I just wanted to give an analogy. Maybe it makes it clearer. So, for example, I intend to travel from, I'm sure majority of you will know Irua, and you are based in Benin, so you know Benin. So I intend to travel from Irua to Benin, and my research question is, how long does it take to travel to Benin? That's the question. So I can now, when I'm carrying out the research, I can break down my objective. So how long does it take me to move from my house to the park? That's one task. The second task, how long does it take me to move from park to Ramat Park in Benin? That's second task. The third task will be, how long does it take me to move from my Ramat Park to my house in Benin? So each of these objectives, I will carry out studies to confirm the duration. Eventually, the 3 of them combine together to help me answer my research question. I hope that makes it clearer and simpler, though it's an oversimplified example.
Yes, sir, I believe it does. I also have a question. Of late, I've been seeing that there have been some complaints in the academic community, being that a lot of young researchers and undergraduate students, if I say so, go on doing research, and sometimes this research, should I say, are not important. So at the end of the day, they end up producing a lot of papers that most of which are not, should I say, readable. What advice do you have for these students in like thinking generally? Because some of these students just want to try to start building their technical skill in research writing, and you really can't do that unless you write. So most times the first few papers or something of that sort might not be so great. So what advice do you have for people to put out good academic publications out there, sir?
Okay, maybe I'll also allow Dr. Lawal speak, but I'll just say a few things now. One of the things I will advise you is to be absolutely intentional. And what do I mean by that? Now, in fact, what you're talking about is not just something related to young researchers, even established researchers. We're in a situation, or we're in an atmosphere where people just do research not necessarily because they want to solve a real problem, but they just want to add to their portfolio, either because they want to get promoted, they want to become professors, they want to pass an exam, they want to, Many people do that. I've also been a victim of that. And in fact, one of the things I'm very, very happy for being linked to Professor Morenike is the fact that she has ingrained and drilled this into my consciousness that research is to solve problems. So if we are saying we're researchers and we're just churning out works that are not really solving anything, not solving any problem, we just want to add it to our CV. Yes, I have 10 papers. Now I can move to the next level. I can become a this, I can become a that. We are not helping ourselves, we are not helping our society. So you should be intentional while you are doing your research work. Join research groups, join your colleagues, your senior colleagues, those who are participating in research. Look for avenues such as this, where you can meet like minds, people who know what research really means. So be intentional in your research networks, the kind of places you join, the kind of research teams you join. That will also help your outlook. So that's just the way I'll answer that. I also like Dr. Lawal to comment on this, if he will.
Yeah, Dr. Okay.
Dr. Prof. Morenike
Yeah,
is
please,
It's okay. I think you asked an excellent question, and I think it's not just excellent, but it's also timely. And I'll answer it in two. It's building on what Dr. Osahon said. When we started the manuscript training ops for students 2 years ago, I think we're moving into the third year now, it was because of a problem. One, we noticed that students had started publishing and the quality of publication was completely compromised. Many would not pick it. You would have to be really good in research to see the compromise. Because, I mean, methodology is methodology. You just, instead of something being 0.051, you do 0.05 and it's statistically significant. And then when I inquired, one of the things I heard from the students is that it builds your portfolio so that you can travel abroad. So while researchers, senior colleagues in my own generation, we were doing research just to get promotion, what you're starting to see happen with students is that they're doing research so that their CV is looking good and then they can travel easily. I'm not saying this is cross-cutting or everywhere. Medicine is mentorship. Medicine is mentorship. You cannot read your way through to become a medical doctor. It's also the same thing in research. While we may read and understand, skills, writing manuscript has to do with skills, and skills has to do with mentorship. And therefore, the advice will be that for your first 1, 2, 3, get a mentor. Work with a senior person. You can't truly get it right on the first paper. There's going to be so much error with the first paper, which is normal. And like Kudus would normally say, and like that I share, manuscript writing is as simple as A, B, C. It's as simple as that. Once you know it, believe me, you can write one manuscript every day once you have the data. Once you know it. However, go and check everybody that learns ABC. It took you 5 years to learn ABC. You went into kindergarten 1, kindergarten 2, class 1, class 2, and through that process, people were holding your hands. You were tracing. Now, ABC is like, are you kidding me? Somebody says, I don't understand ABC. You say, what? It's impossible. But it took you 5 years to learn ABC with some people holding your hands. You never woke up and learned ABC. And that is it. These things are good. These things are fundamental. Once you are discussing, you will discuss with competency and understanding. But please note, you can never write a first manuscript well without mentorship, without somebody holding your hands to do the ABC. So please don't go rushing. Just like Dr. Saho, it's very important that you understand the fundamental of research. You can't go into research because you want to get your CV filled up. You must know that you are answering a question, because every single manuscript out there published in reputable journals is a stepping stone for the next person. Somebody analyzes it. They will analyze it in scoping reviews, analyze it in systematic review. Even if it's primary study, is the basis for setting the next research question. I've spent a long time, but I'm speaking from the depth of my heart. I still see a lot of medical students who are doing research and it's faulty. I see it, and it grieves my heart. It really grieves my heart. A number of you are also doing things that they're telling lies, and they know they are telling lies. So that fundamental is very important. Apologies for stepping in, and over to you, Kudus and Osahon. Thank you.
Absolutely.
Thank you very much, Ma, for your insights on this question. It's very much appreciated. And I hope everyone here took note of that. Thank you very much, Ma. Dr. Lawal, please, do you want to say
Yeah,
anything on this?
nothing to add. I mean, I was just going to make reference to the fact that the idea behind Student Manuscript Writing Hub program is to build the capacity of students to do research, but not just to do research, but to do it in the right way. And the reason why we support journal clubs like this is because we believe that as you start your journey into research and manuscript writing, you should do it well. There is no benefit, there is nothing to be proud of in doing a research that is not well done, or you are writing a manuscript that is not well written. The fulfillment that comes from writing is when you look back and you tell yourself that I've done it well. I also note that people have done research long back in the days, and later in their career, it came back to haunt them because they didn't do it right. So it's better to start it right and build up doing the right thing. Thank you.
Thank you very much, sir. So, Dr. Osahon, there's a final question in the chat box, which is, in one of the examples of research questions during the session, it was, what are the barriers to vaccination uptake among children? The research question always have to begin or start with what, how, why, and so on. That's the answer.
So the essential thing, it's a question. So it's asking how the questions begin. Most questions will always often start with what, why, and stuff like that. So it's a question. And forget that it's a question. So because it's a question, it's framed as a question. It's different when you're talking about objectives. But once it's a question, it's framed as a question. What is, yes, it's a question. So it should be framed as a question. I hope that's what you were asking.
Yes, sir. Thank you very much, sir. Thank you very much, Prof. Maranike. Thank you very much, Dr. Lawal. Thank you very much, Dr. Osahon, for your contributions today. They have been life-turning, I would hope. Thank you very much, sir. And thank you very much to those that were able to join this session today. Thank you very much. With the absence of more questions, I think we have come to the end of this session today. I hope it was a learning experience for each and every one of us, as it was for me. We'll see everyone next week, Friday, by 6 p.m. The recordings and the questions on the last two sessions will be sent between today and tomorrow. Thank you very much. And thank you very much to our speakers, our facilitators once again.